with the session, right?
Yeah, absolutely.
Sumit, I'm trying to log in from my laptop, okay? So if you see me switch, that's what's happening.
Okay, we'll manage that. I guess we are now live.
Yeah, welcome all of you. Thank you again for joining this very, I'm very much excited by the way for this session. First time we are doing an international webinar as far as the medical cannabis is concerned. And again, thanks all of you for joining, and we are very much happy and pleased to welcome all our esteemed speaker. We have Dr. Roman, and a second. Yeah, sorry. So we have Dr. Uma and Dr. Joseph with us. Will be introduced by Sumit Sinha, founder of Happie Hemp. I again appreciate and congratulate especially to him for this effort that he was able to manage and get eminent speakers across the world on our platform, because this will be very crucial for all the doctors and people who are like right now will be joining us in a while to have this session and to have an insight from our international fraternity and community as far as the medical cannabis practice is concerned. Because although we have seen that this plant is from some ancient background of Indian Vedas as well, still we are very behind as far as the modern research and overall scientific aspects are concerned. So it will be a great learning for all of us as well. On the same note, we are very exhaustively practicing full spectrum medicines here. So on that aspect, we are having a good now experience personally, because we have a very exhaustive patient pool. So although we started late, but like for example, in my practice from last around 2.5, 3 years now, around more than if I collect the entire data, around 8 to 10,000 patients till now we have been administered as far as medical cannabis is concerned, and we are now structuring and ensuring that some data points and some clinical like data points and sometimes of retrospective uh, like uh, uh, surveys, or maybe in future some clinical trials also will be doing. So on that note, I again welcome both of our speakers today. We have so many other guests also on Zoom, and several people will be starting seeing us on live in a while on YouTube. We have just started the live. And I request again and I welcome Sumit Sinha, the founder of Happie Hemp, to quickly introduce our esteemed speakers and start the proceedings of this webinar. Thank you so much again for joining. Sumit, over to you.
Thank you, sir. Thank you so much. I guess, yeah, Dr. Uma is back with the video, I guess. So I think I've been trying to do this from a very long time. The idea of cross-learning is very important when it comes to medical cannabis, and pooling in the expertise and experience of people, those who have been prescribing it exhaustively, be it across any geography, is very important. And this kind of gives me an immense pleasure to host it for all the practitioners across the globe, and especially for those who are in India, those who've been trying to understand the plant, practice the plant, but the information that can be shared via this will be so much of benefit for them, encouraging as well. So, on that note, I would like to introduce our speakers for today, our panelists for today. So Dr. Joseph Rosado is one of the world's most respected medical authorities on cannabis as plant-based medicines. With over 4 decades of experience as a healthcare professional, he has built a career anchored in the family tradition and driven by a desire to help his patients and community. He trained as a certified nurse assistant and began working in the medical field in 1978 at an age of 16. So, that's the kind of amount of expertise and the exhaustive cross, within the medical fraternity he has is amazing. He has written multiple articles for medical journals, as well as he has published a book. It's the bestseller available on Amazon, goes by the title of Hope and Healing, A Case for Cannabis. Dr. Rosado holds degree in clinical nutrition and chiropractic medicines from Life College in Merida, He has a medical degree from Universidad Central del Este from Dominica Republic, where he graduated as summa cum laude. In 2005, he completed his MBA in healthcare management from University of Phoenix and graduated, magna cum laude as like the top of his class. In 2018, he became a diplomat of the American Academy of Cannabinoid Medicine. In early 2020, he became a medical review officer in June 2020, he became certified ketamine assistant psychotherapy with the entire clinical team at the Polaris Insight Center in San Francisco, California. And also to add upon, I think he's been one of the first physicians in Florida to prescribe medical cannabis. He has expertise ranging from adults to patients below the age of 18. So we are so fortunate to have you, such a diverse and long career into medicine. You have it along with a strong forte in medical cannabis, and we are looking forward to learn from your experience, and obviously any insight that we can get. And all those who are listening to us, I would recommend that please get a paper and pen, start writing down the insights that's going to come out from the discussion. So the next panelist is Dr. Uma. So Dr. Dhanabalan is a highly respected and educated physician and known to most as Dr. Uma. She completed her Bachelor of Arts degree with high honors from Rutgers University and her medical degree from the University of Medicine and Dentistry in New Jersey. She completed her family practice residency at the Medical University of South Carolina. She has her master's in public health and completed her occupational environmental medicine residency and fellowship in heavy metal at the Harvard School of Public Health in Boston, Massachusetts. She's a fellow of the American Academy of Family Physicians. She's a diplomat in cannabinoid medicine, certified by the American Authority as a cannabinoid medicine and a medical review officer. She's also founder and CEO of Global Health and Hygiene Solutions, established in 2006 with a mission to promote wellness and prevent illness. She's an educator, advocate, activist, and speaks globally. Personally, I've been following her from a very long time. I've had the opportunity to listen to her on multiple occasions on various national and international platforms. She created the model of total health care, THC, and runs an independent clinic at Uplift Health, where she educates, embraces, and empowers her patients and public about preventive health and side effects, including cannabis as a plant medicine. Her mission is to change the stigma regarding cannabis for the world to know about the endocannabinoid system through education. The amount of immense knowledge that she has is going to be reflected when we'll kind of go to her and talk questions around it. And I'm so happy that we have her on this panel of the discussions, and we're looking forward, even I'm looking forward to understand and know a lot around the medicinal cannabis. And obviously Dr. Piyush is one of the India's foremost expert in Ayurvedic and herbal medicines. He is one of the India's pioneer doctor who understood and adopted medical cannabis into his practice. And he's also an active voice in the medicine fraternity around the acceptance of medical cannabis. He's currently a practicing Ayurveda physician and a consultant to several national and international organizations for clinical trials, R&D, business development, regulatory affairs, and contract manufacturing. He studies Bachelor of Ayurveda Medicine and Surgery from Gurukul Ayurvedic Medical College, Haridwar, one of the oldest colleges of this country. He also did post-graduation in clinical research and MBA in project management. He has also completed medical cannabis essential from the Academy of Medical Cannabis, London. He's also founder of Indian Vaidyas, CBD Vaidyas, and exhaustively working on educating doctors in India and obviously, encouraging people to rightfully adopt the plant. So I'm so happy to have three leading practitioners who understand the medicines, who have the expertise that I believe everyone should be looking out to build, to kind of heal people in a more positive sense. And I would like to learn from their experience. Now, this kind of takes me to start the discussions. And whenever you talk about medical cannabis, we always begin the discussion with endocannabinoid system, okay? Because that's the first thing that should be discussed before taking a deep dive into any other aspect. So my first question of this discussion to you, Dr. Uma, is that tell us about the endocannabinoid system and its role in our wellness, in treatment, and anything and everything that comes to your mind. Over to you, Dr. Uma. Can anyone unmute Dr. Umar?
Can you hear me now?
Yes, please.
Okay, wonderful. Good morning and namaste to everybody all over the world. It's a pleasure and an honor to be here. The first thing is that the endocannabinoid system is really never was taught to me. It was not part of my education. I've had over 30 to 40 years of formal education, and never was the endocannabinoid system taught to me. I started to learn on it on my own due to my mother in 2010. And what we realized is the endocannabinoid system is a mere 600 million years old. It has evolved from a sea squirt to what we have in humans today. And it is involved with most every system in the body. And the way I like to explain the endocannabinoid system is that it has receptors. There's also within our own body, we produce endocannabinoids. There's also enzymes that cause synthesis and breakdown. So it is a conglomerate of endocannabinoids, receptors, and enzymes is how I like to explain the endocannabinoid system. And the function of the endocannabinoid system is to bring about homeostasis, balance. And I like to explain it as ease. And if we don't have ease, we have dis-ease. And in our world, we have fancy terms for these dis-eases, from dermatitis to arthritis to gastritis to carditis. It's some form of itis, which usually has some form of inflammation involved in it. So Dr. Damaso explains the endocannabinoid system in 5 beautiful words, and I use the mantra of it helps us to relax, eat, sleep, forget, and protect. And each of these words have to have a balance. If not, again, disease. The way I like to explain the endocannabinoid system is in one word, life. Because if any one of these 5 words is not at ease, we have illnesses. If your muscle is constantly twitching or doesn't move, if you eat too much, obesity, if you don't eat enough, anorexia, if you sleep too much, depression, if you don't sleep enough, insomnia, if you forget too much, Alzheimer's, dementia, if you don't forget enough, post-traumatic stress, if you overprotect, autoimmune diseases, underprotection, you're immunocompromised. So it's involved with any part, and that's why I like to describe the endocannabinoid system as life.
Thank you so much, Dr. Umar. That was really, a very different way of understanding things rather than just going into technicality, but on a very broader level, how this impacts our entire journey of life, actually. And all these combines together to help us live a life that is more fulfilling rather than, more of demeaning or chasing, right?
And
so I think
along with that, we want to explain that it's very analogous to the nervous system. So dopamine and serotonin are created in the presynaptic neuron and released, and they bind to the postsynaptic neuron. Endocannabinoids are unique in that they're made in the postsynaptic, they're released, and they bind to the presynaptic. So it's a very unique retrograde mechanism, and each person is different. And that's why the whole practice of cannabinoid medicine is very personalized, and it comes back to our Ayurvedic medicine as well.
That's wonderful to know. I think since you mentioned the word Ayurvedic, I would kind of direct the next question to Dr. Piyush, that since he's been actively prescribing and managing various patients out in India. So what do you see the role of medical, Dr. Piyush? This question is to you, is that what role of medical cannabis do you see in mental health? How medical cannabis can help mental health patients, and what all conditions it can be prescribed, and how do you see it playing an active role in the wellness journey?
Right, Sumit. First of all, I again welcome Dr. Uma and Dr. Joseph, and thanks to you to ensure that we are having this kind of session. And very well explained as far as GCS is concerned, and a new perspective we have learned from you, Dr. Uma, today. So as far as the endocannabinoid systems are concerned, already it has been mentioned and described by Dr. Uma, and the question which you have asked about mental health. So quickly, let me just connect that aspect. See, we all know about the receptors we have, like CB1, CB2, and all those aspects. And to start with the mental health, a very interesting, aspect which we need to understand is, so there are human cannabinoids, and there are plant-based cannabinoids. And if you talk about the human cannabinoids and human endocannabinoids, so the two we have to mute others. Just a second. Yeah, sorry. So when we have to see the names of these two, we all know about AGA and Anandamide. So Ananda is a word in Sanskrit which means happiness. So if you see the discovery and if you see the nomenclature, so the mental health which you have mentioned, so this plant is basically related to giving happiness and joy and spreading that feeling of that you are happy. And it's not a hypothesis, it's a science, it's a logic, it's a science that we need to understand. So all these receptors and all these aspects which are there in our brain, in our neurons at a nerve level, and but we see that yes, when we also give plant cannabinoids to these patients, so the neurotransmitter secretion is being enhanced when they are just binding with these receptors, the plant based cannabinoids, that is CBD and THC. So if we start understanding from that perspective to the level of when we are seeing clinically, like for example, if you talk about mental health, so all these diseases, be it anxiety, depression, it starts basically from stress and anxiety. But then there are depression, there are OCDs of the world, there are patients with schizophrenia and other mental health conditions. They are going into psychosis, they are having several issues with respect to their sleep. In fact, mental health is directly related to sleep. And when we are talking on all these diseases, when we are talking on all these mental health issues, each and every disease and each and every mental health disorder is getting healed or is directly or indirectly related with cannabis in many aspects in terms of the healing is concerned. So it's not only suppression, it's the healing which we have seen as far as cannabis is concerned, that we need to first of all understand. So there are two aspects of mental health. In fact, again, because there are so many doctors right now, but there are some non-medicos as well who are attending this session today. But for doctors also and for both of them, we need to understand like for example, any mental or any patient having mental health, they have two options. Either they go to a psychiatrist if it is a predefined medical condition, or maybe they have diagnosed with a condition where they need medicines. Otherwise, they go to a counselor or a psychologist as well, or both as well sometimes. So that aspect with cannabis, I have seen as a doctor, if you are also doing some kind of a basic counseling and you are giving the cannabis medicine, so that aspect can be taken care of. Because why they are going to psychologist? Because they need their mental health stable. So I'm not saying that psychologists are not required or psychiatrists are not required for mental health, but when we are seeing with cannabis, with medical cannabis, these two aspects are being very well handled, because it's not suppressing, it's healing. And in that way, the role which the anti whatever the medicines they are taking, the psychiatric medicines they are taking, or the counseling they are taking from the counselor, in both ways, when we have when we have induced or when we have introduced them to the cannabis, so one side their medicines are getting reduced, or sometimes after a point of time they are not actually having the need of taking those medicines, they are just taking the cannabis medicines. And second, when they were going to counselor, that aspect also gradually reducing, and they are more happy, their sleep is fine, deep. In fact, in one research I was reading that the negative thoughts or the negative the past life, maybe PTSDs or all these aspects, whatever we are seeing in our dreams, that is also gradually being converted into the positive thoughts. That is one research finding was there. So means in a nutshell, if negativity inside, whatever we all are having, is getting converted into positivity by this herb, I think that is a very important aspect. And I'm not saying this hypothetically. Research studies are saying this, and Dr. Joseph and Dr. Uma may be having a better understanding because they are more connected to all these research studies in their country. So the point is the negativity is getting converted into positivity by this herb first. Second, if there are some disorders, some pathologies that are also being healed in terms of certain kind of inflammation, certain kind of cell or tissue injury, or whatever is there. And third, the overall mood, the overall happiness index we can measure, or the people are able to sleep well, they're getting up fresh, they are feeling light, their dreams are better in quality, the REM is being controlled, and they are having a deep sleep, because that is very crucial for mental health. And overall also they are calm, settled, they are not that much hyper when they are into cannabis. And also all these aspects, gradually we have seen that people are feeling better. And yes, we also need to understand and ensure the standard combination, because high levels of THC can sometimes aggravate the things as well, which also we need to understand as far as the mental health status is concerned. So there has to be a balanced, because in India predominantly we are using full spectrum, so the CBD, THC and all these ratios are not that much miserable as far as India is concerned. Still, with the full spectrums, we have seen that we are able to manage and help many people as far as the mental health is concerned. So on that note, I will hand over the session to you again to have more questions on that aspect. Thank you.
Thank you, Dr. Piyush, for underlying the uses of medical cannabis and its impact. Now, talking about the help, sometimes medical cannabis becomes more of a I'm not sure if I'm correct or not, a better medicine, right, to be prescribed. But when it comes to rare conditions, right, where you don't have a medicine that can treat it, or where there is lesser medication that can offer relief for a patient, right? So the next question I would like to know from Dr. Joseph is that what role do you see, or what kind of rare conditions do you think that medical cannabis is effective in managing, where the modern medicine or the pharmaceutical grade medicines have not been up to that mark? Over to you, Dr. Joseph.
Thank you. And it's a pleasure to be here. As Dr. Uma mentioned so eloquently, any lack of ease is a criteria for the use of medical cannabis. Dr. Ethan Rousseau has published a very elegant paper back in 2016 where he discussed clinical endocannabinoid deficiency, or CED. And the three main conditions that were affiliated or associated with the clinical endocannabinoid deficiencies were fibromyalgia, migraine headaches, and irritable bowel syndrome. But as he further studied, they discovered that there were other conditions, named conditions, that also fell under that clinical endocannabinoid deficiency. And under there, we have post-traumatic stress disorder, failure to thrive in children. We've noticed that ASD, autism spectrum disorder, children with ASD also fall under that clinical endocannabinoid deficiency. There have been studies showing a lower level of endocannabinoid production, as Dr. Uma mentioned with the endocannabinoid system, how we produce our own endocannabinoids. By having that deficiency, we need to replenish it. And the way we replenish it is by receiving it exogenously from the outside in. And it comes from the plant, hence phytocannabinoids. Phyto meaning plant, cannabinoid meaning that they work on the cannabinoid receptors in the endocannabinoid system. Therefore, any condition that can lead to an endocannabinoid deficiency would then benefit from the use of medical cannabis in all of its forms. So any chronic disabling disease, which is the definition in the state of Florida, any chronic debilitating conditions, as well as certain named conditions.
So I think this kind of get extended to a lot of conditions that can fall under or can happen because of the deficiency in the endocannabinoid system, right? Okay, understood. So I think in my exposure to patients, right, I've seen Parkinson's patients. I mean, they are the one who are aggressive on searching various medications available because there's no one particular medicine that can help them. I've seen, as you mentioned, PTSD patients. So Parkinson is something that I have seen patients opting for medical cannabis. So can you name some of the rare conditions where cannabis has come out as a very as a I would say a potential management medicine? Treatment is something which I may not be very heavily upon to use, but as a condition management. So a couple of condition where you have seen cannabis giving good results.
Sure. Autoimmune conditions are the main ones because of all of the inflammation that comes along with autoimmune conditions. So rheumatoid arthritis, lupus, scleroderma, Sjogren's are very common types. Also, those are the traditional diseases. Now, I've also seen patients with diabetes because of the inflammation, or people with metabolic syndrome that have elevated blood pressure, have high blood sugar, because certain phytocannabinoids and terpenes help normalize and control blood sugars, THCV being one of them, humulene being another, which helps in lowering the body weight. And so those work on the GPR55 receptor, and it lowers blood pressure, lowers blood sugar, and it lowers the weight. And so those are benefits for people that have diabetes, hypertension, etc. As far as other mental conditions or mental health conditions, we have post-traumatic stress disorder, anxiety, depression, insomnia. All of those fall under that umbrella that support or are supported by the use of cannabis.
Thank you.
Sure. I just want to add, this is very true, autoimmune conditions, and this is where we talk about, the mantra of protection. Overprotection is just as bad as underprotection. And this is the imbalance we talk about autoimmune diseases. My youngest is 2 in my clinic, and my eldest is 98. So I truly get to practice family medicine. And what we see is that, initially the patients come in for treatment of these chronic conditions. We have patients with glaucoma, rare types of cancer. I have ALS patients. I have children with mitochondrial diseases. We have, various brain tumors, gynecological diseases that we're going to be talking about. But mental health, I think today, especially with COVID, we are seeing the whole world has PTSD. And I like to kind of drop the D in PTSD because there's a lot of stigma that we talk about. And I think verbiage and how we use the words is very, very important. And when we label people as disorders and diseases, that itself gives a lot of trauma, I think, and I just call it post-traumatic stress because I think we can understand how we're all impacted. And this is what we're understanding is that the endocannabinoid system is very unique to people, and everybody's endocannabinoid system is different. Dr. Joseph mentioned phytocannabinoids, he mentioned GRP. These are all receptors, and we're learning so much. And that cannabis as a plant has 3 very important components: cannabinoids, it has flavonoids, it has terpenoids, and then it has fatty acids and many, many more things as well. But all of these work with our body to bring about ease. And everybody's different, and we're going to learn more. And we have so much information. And that's the other thing. Do not get confused. Do not get confused when they tell you we don't have information. PubMed has so much research. Cannabis is nothing new, folks. It's been around for thousands of years. It's part of our Ayurvedic medicine. It's a sacred plant, and it can be used. And I call cannabis the exit drug, because we've seen patients I've eliminated, lowered, used in adjunct, and that's why we've seen decrease in opioids, pharmaceuticals, alcohol and nicotine, even weight loss and weight gain, depending on the individual.
Absolutely, absolutely. It's a very personalized medicine. What may work for someone may not be the best treatment protocol for the other person. It's a doctor who has to understand the person and their, how the endocannabinoid system is functioning, and then obviously decide the treatment protocol and ensure that the end wellness goal is achieved. So on those lines, since we've been doing a lot of webinars, a question has been persistently coming to us is that in what all gynecological conditions or cases medicine or cannabis medicines have proven to be effective. If you can shed some light on that.
Absolutely. So we need to discuss a little bit about system, and I'm always about systems. Okay. So when we talk about gynecological issues, I want to talk about the hypothalamus, the pituitary, and what we call as the gonads. In women, we talk about the ovaries and the uterus. In men, we talk about the testes. So when we talk about this axis, there's hypothalamus releasing gonadotrophin hormones. From the pituitary, there's the release of LH and FSH, and the organ itself releases estrogen and progesterone, and these impact the uterus as well. So when we talk about each of these systems, the endocannabinoid system is involved. There could be dysregulation, as we call it, between the hypothalamus and the pituitary to the organ system, or from the organ system to the point of where it's being released. So each one of these is where cannabinoid medicine is applicable. From patients, if we look at gynecological issues, from a young woman just reaching puberty to going through end stage of menopause. So I get to see it all, and I've kind of experienced it all too. So on a personal note, we understand that puberty is very anxiety driven. There's actually physiological changes from breast development to every part of your body changing, to pregnancy, and how the endocannabinoid system is involved with, from implantation to the continuation of the pregnancy to actual even delivery and even lactation. So it's involved with every part of a woman's gynecological system. And what we understand is that these CB1 receptors and CB2 receptors are well studied now, and also the dysregulation of these enzymes. Okay, so FAH and NAPDH, these are all enzymes that are involved, and we're understanding too much or too little for each person can vary. This can be with endometrial cancer, endometriosis, ectopic pregnancies, miscarriages, and the list goes on. But what we're understanding is that it is so much involved. I see patients with polycystic ovarian disease. I see women with amenorrhea. I see women that have amenorrhea, meaning not getting their periods, related to anorexia nervosa. So when I treat the underlying condition, then they start to ovulate. And then once they ovulate, they can actually try to get pregnant. So these are all step-by-step processes. So this is where I truly love what I do, because I get to spend time with a patient. Our initial consults are about 45 minutes to an hour. I follow my patients. And I want to clarify, in the United States, doctors don't have the liberty to write a prescription yet. We can only write a recommendation. And this is a state-by-state decision. And these are made with medical, and I dislike the word marijuana. I think we should be using cannabis. That's the formal word. And it should be a medical cannabis program. And so depending on, like Dr. Joseph had mentioned, we have the liberty, at least in Massachusetts, I get to practice medicine as a doctor because they've made it broad enough to say chronic and debilitating conditions. But some states have limited it to certain things. They've limited it to what age and so on and so on. But to understand that, yes, it's involved with gynecological issues. It's involved with men and women. With men, it affects, again, the Sertoli cells and the Leydig cells in the testes, which is involved with testosterone production, sperm production, and each of these imbalances can have an impact. There's a lot of research studies that you can see as far as concerned, as far as men and women using cannabis and how this impacts infertility. Fortunately, I had worked with infertility in the 70s and 80s and understanding how we could hyperstimulate people's hormones, cause pregnancies to be maintained in the uterus. So understanding the research and understanding the physiology and the anatomy, and now having another tool in my repertoire to use cannabis is phenomenal. And I use it in pretty much all delivery mechanisms as I can. And that's about from either topical, the skin is the largest organ system. We can use it orally under the tongue. We can ingest it. We can even put it on the belly button, which goes back to our Ayurvedic days of my grandmother using the Pakoti method. And that's a perfect way to address gynecological issues, because right there is the belly button. And that's a remnant of what was attached to the umbilical cord, which was attached to the placenta, which was what sustained life of that baby till delivery. And so understanding the endocannabinoid system is the key, and why I am so passionate that we must let everybody in the world know that we have an endocannabinoid system. And if there's one mandate that I would like to see on a political note, is that every healthcare provider must be taught that we have an endocannabinoid system. Unacceptable. Unacceptable, especially in the states and countries where we have a medical cannabis program, period. And so when we look at gynecological issues, I use it for helping women get pregnant. I help women to go through the ease of menopause. I have women with ovarian cancer, endometrial cancer, cervical cancer, and this could be primary cancers. It could be secondary cancers, meaning metastasis, and also due to trauma. Viruses can cause cervical dysplasia. We can have different types of infections that can cause also different types of issues. I have women with lichen sclerosis, which is an inflammatory skin disease that can be mostly in the genital and anal areas, and that impacts their quality of life. Pain with sexual activity is not just a woman's problem, it's a man's problem. And 3 questions I ask my patients: how's your peeing? How's your pooping? And how's your sexual activity? I'm a doctor. I can talk about these things, and we should be talking about these things because it impacts the quality of life. And truly, I believe that there's safety measures that have to be taken. So Dr. Uma says, safety first and do no harm. As clinicians, we're told do no harm, but I truly believe this is one of the safest medicines that we can use if it is administered properly, and we know that it is produced clean. These are the 2 important factors, especially when we're talking about putting it on your skin, ingesting it, and even suppositories. I use vaginal suppositories. I use rectal suppositories. If you got an orifice, Dr. Uma is going to use it. Okay. And so it's about understanding different delivery mechanisms. And gynecology is right there.
No, I think delivery mechanism does really makes a lot of sense, because how ensuring the bioavailability is probably the key thing, to treatment. I mean, and obviously depending upon what kind of condition is in question, that also ensures the same aspect. I think the belly button is something that is something new I've heard, actually, and it's something I'm going to go back and understand how how can this has never been in my sight of knowledge. I may speak with Dr. Piyush post the call on that. So I think moving on to that, Dr. Piyush, when it comes to lifestyle disorders, right, which probably has prominently increased over the last couple of years, how do you see medical cannabis playing a role in helping people with those conditions?
Yeah, Sumit, as far as lifestyle disorders are concerned, there is a very broad term. In fact, if you talk on lifestyle disorders, there are so many indications and so many diseases, or maybe as Dr. Uma was mentioning about the various systems. So, but yes, let's understand some, because I will not be able to touch upon all the lifestyle disorders in this session today. But to just cut short, and maybe if we consider maybe top three or top five lifestyle disorders, or like if you understand about the segment wise, so there are three four main aspects which we need to understand here. Is one, the respiratory system, like as far as the I in fact I will categorize the all the infections, because this COVID is I will not say, on one side it can be categorized into the infectious disease, but for me it's a lifestyle. It's like the mentality, the mindset which we all have, and due to that we are getting exposed to these kind of infections which we should not be. So if we, and pollution and certain other chemical aspects or whatever, respiratory system is one of the like most I can say exposed system in these scenarios. And there are some studies in fact with respect to this virus, that is COVID, and some other say superbugs or some other infections. And overall also we have seen in respiratory system, cannabis and the medicines from cannabis, medical cannabis is very effective. Be it the cytokine storm, be it the interleukins, be it the various kind of inflammations, pathologies, whatever you want to quote. We have seen that in many aspects cannabis is helping. And like we have patients in our clinic, and we have seen that they are coming with uh, complaints of breathlessness, COPD, asthma, many other aspects are there. And we have seen that they are getting relieved after starting the medical cannabis, of course, with some other like Ayurveda medicines also we are giving to them. Second aspect is, in fact, one of the most significant, and again in India, we are not that much practicing cannabis as far as the flower and bud aspect is concerned, that is cancer. So, cancer is also spreading across the world now. Many countries are facing this, that they are having the top three. If we categorize the top three or top five patients as per the diseases, the cancer is always there in top three or top five. And that is also, I will say, as far as the lifestyle disorder is concerned, all these radiations, chemicals, sometimes stress, anxieties are at that level, or sometimes genetic reasons, or many reasons we can quote for cancer of various types. And it has been well proven and well researched that starting from the like converting the cancerous cell into the non-cancerous in many studies, to the extent of managing the side effects, the chemotherapy or radiotherapy side effects, the pain management, nausea, quality of life. So many aspects are there as far as the cancer patients are concerned. Right now in India, predominantly we are managing the quality of life. We are managing, like we are helping them to reduce the pain. We are helping them to have, like they can have their food, their appetite, their nausea. All these aspects are being managed right now, because we don't have the access to the higher THC medicines as far as India is concerned. But yes, we have seen in West, I have seen certain documentaries, I have seen certain research papers, I have seen certain real-time examples and cases where cancer patients are being managed uh, along with other standard of care and cannabis. And we have seen on record medical oncologists and other people are saying that first time in their life they have seen these kind of healings. The chemotherapy cycles are being reduced to 50%, or the recurrence rate has been reduced to a significant 40 to 50%. And certain kind of cancers which they were not able to heal with the standard of care, the prognosis was not that good. And they have seen when medical cannabis has been introduced, the prognosis has improved. At least they have added few months or sometimes few years to the life of the patient. That is a very significant aspect. Although more and more research and more development will be coming up, and we can't claim right now that this is the medicine for cancer. But on the same note, we can't deny the overall benefits and the overall like the patients who are getting benefited through the medical cannabis with a significant amount of THC. And then the third prominent category of like lifestyle disorders is like the degenerative disorders in terms of Alzheimer, Parkinson. You touched upon Parkinson. although Alzheimer, Parkinson, and these diseases also are not that much, like we can't claim that we can cure or maybe we can completely eradicate. But yes, in these patients also we have seen, because in India this is also growing now. Earlier it was not that much, but now it is growing, and so many patients are coming with Parkinsonism, Alzheimer, and other degenerative diseases as well. And we have seen that in these patients also, cannabis is improving quality of life. The nervous system is badly impacted, and which cannabis is healing at a very significant level. I have seen people who were not able to walk properly. They were taking help with their sons or grandsons, daughters, and all. They were coming with them in the clinic. After a few months, they are at least walking on their own. They are able to do day-to-day stuff, like using washrooms, going to have their meals, and all these basic stuff, from their bed to the dining rooms to the washrooms. These kind of basic stuff, at least they are able to do on their own without the help of any family member. That is a very significant improvement you see clinically in a patient, and they have exhausted all the treatments. Typically, in Ayurveda these days, also in India, patients are coming after exhausting all the other standard of care, and then finally they approach us. Okay, anything Ayurveda can do? Or like when we ask them to start medical cannabis on that note. So it's not the first line of treatment, by the way. We need to understand. Sometimes it is the last option they want to try. And after that, the point which I want to make here is they've already exhausted and already spent so many years in trying all the medicines which are available. Still, their conditions are getting deteriorated. Their conditions are getting decreased day by day. And with cannabis, with few months, that is getting better. That is a very significant aspect which we have seen in our clinical practice. And so many other lifestyle disorders are there, but I want to pause here, at least for these scenarios. Maybe Dr. Uma and Dr. Joseph wants to add on to these diseases as per their experience as well. Thank you.
Thank you, Dr.
Dr. Piyush, you've hit on several things that I want to touch upon. Thank you so much. Number one, you mentioned quality of life. And when I see a 2-year-old I know that has a brain tumor and is going to die, okay, and they're puking their brains out, they can't eat, they can't have any quality of life. And it's not just the individual, it's the family and other family members watching this. So this is why I say cannabis must be a first line option and not the last resort. I've repeated this and I've screamed this at the top of my lungs. When you hear cancer, especially when you hear cancer, cannabis must be automatically part of every treatment protocol. There's 4 very specific properties, and I've dealt with chemotherapy drugs. I did research from animal to tissue culture to monoclonal antibodies to human research to understanding what chemotherapy does, okay? Chemotherapy affects every cell. Cannabis, on the other hand, targets the cancer cell. And there's 4 very specific properties I want people to write down here, okay? Number 1, it causes the cancer cell not to multiply, anti-proliferation. Second thing, doesn't let the cancer cell spread, anti-metastatic. Third property, cuts the blood supply off to the cancer cell, anti-agenesis. Fourth and most important property is called apoptosis. Fancy word for cancer cell commit suicide, die. That's what it's telling it to do. And these are the 4 very specific properties. We're also seeing in children and cancers that where the cancer is not become specified, that it actually helps the cancer cell mature. So it again causes the cancer cells to be attenuated. So this is the very important properties, and the research is there. And the other thing that you mentioned is what is known about Parkinson's. The United States of America has a patent, folks. Write this number down, 663507. I'll repeat that again. Patent number 663507 that was issued on October 7th, 2003. This is one of the facts that everybody should know. Cannabis is an antioxidant and neuroprotectant, and the government has known about it for Alzheimer's, Parkinson's, dementia, stroke, and cardiac issues. So I use it for preventative care, maintenance, and treatment. And it should be understood. Start eating cannabis in the form of hemp food, and that could bring down inflammation. Even if you don't want to use the full spectrum, start with eating hemp. And this should be available worldly. It should be not an issue, and this is the other thing that you talk about, death and dying. We want people to have cannabis as part of palliative care. Why should not every individual have the right to die with dignity? We're all going to die. I don't care what religion, what country, who you are, we will die. And we should have that dignity. And that's the other reason why I call cannabis the exit drug as well.
I think, yeah, this has been a very, I think, informative from your end. The patent, I think there's so many things that are available in the scientific community. And obviously governments have known around various medicinal use cases of cannabis plant, even probably prior to the whole, prohibition. Cannabis was prescribed very aggressively, I believe. Like so many manufacturers are making it, maybe not the way we have known the CBDs and THC. This has come probably in the last 40, 50 years, but cannabis has been part of the medication from centuries, right? This kind of takes me to another question, is to understand how medical cannabis can help. And this is a question to you, Dr. Joseph, is that how medical cannabis can help patients of under 18? I'm talking about teens or children's. In your practice, what all conditions you have seen cannabis showing results? And obviously, when you talk about a younger adult or a teenage or a under 18 population, what key factors that should be ensured, right? I mean, when you're prescribing medications to such population.
Excellent question, and I get this a lot because I was the first certifying physician in the state of Florida to recommend medical cannabis to a child. He was 15 years old, had a stage 4 rhabdomyosarcoma of the head and neck. The tumor had eaten his jaw, his cheek, his eye socket. He had to wear an eye patch. It had penetrated his skull and was into his brain. In fact, tomorrow is the anniversary of his passing, of his transitioning, which I'll be going to the cemetery to pay my respects. But in conjunction with all of this, I do have a large pediatric practice because of that. And the most common conditions that I see in children are epilepsy and autism. Those are the two that I primarily see, but I also see a lot of pediatric cancers, a lot of pediatric tumors, a lot of, autoimmune conditions among children. But to have a child that has a condition such as Dravet's or Lennox-Gastaut, these are children that have anywhere between 200 and 300 seizures per day. And then all of a sudden, this child that was having 200 to 300 seizures per day is having 4 to 5 seizures per month. That is a massive improvement. And the quality of life, not only for the child, but for the caretakers, improves dramatically, because now their focus isn't on how are we going to have this child, be free of an epileptic seizure, but what can we do to keep him occupied and entertained, because now they're not seizing any longer. Same thing with children with autism. It supports their ability to gain cognition. They're more cognitive. They become verbal, and they're able to be more expressive. And a lot of parents will tell me that they've gotten their children back. They're able to penetrate and get into their child's psyche and understand what's happening with their children, because now their children are able to communicate with their parents, which is beautiful. To have the capability of engaging. I'm a father of twin daughters and I have 4 grandchildren, and I couldn't imagine not being able to communicate and speak with my children and grandchildren. So that's a huge advantage to have. So those are the main conditions I see with children. Now, one of the biggest misnomers is that by giving medical cannabis to people below the age of 18, you're predisposing them to schizophrenia, or you're predisposing them to mental illness. And that is a myth. As our former president would say, it's fake news. It doesn't exist. Sorry, I got a phone call that came in. It froze me. Hang on. I'm back. I'm sorry. Okay, I'm back. Sorry. I mentioned our former president, fake news, and mainstream media kicked me out. I'm sorry, Indy. I won't say that. I won't say that name again. Anyway, but I see a lot of children, as I mentioned before, with epilepsy, intractable seizures, epilepsy seizures, autism spectrum disorder, and to a lesser extent, childhood cancers, rhabdomyosarcoma, osteosarcomas, bone tumors, and it supports and addresses the pain. It takes care of the pain. The child that I shared with you earlier that passed in February of 2017, when he came to me, he was on a morphine pump. He was already in hospice and was receiving 16 milligrams of morphine through the morphine pump every 4 to 6 hours, but he also had the capability of giving himself a bolus of morphine if he had breakthrough pain in between those scheduled dosifications. And once we started him on the medical cannabis, and it was a 1-to-1 CBD THC ratio that we were utilizing, by utilizing that 1-to-1 ratio, and that's what I use a lot on pediatric patients, a lot of ratio based, because there isn't a lot of information utilizing high levels of THC. So when we use THC, we tend to go on the lower scale or on the ratio, but because this child was so aggressively ill, we went on and went a little bit more aggressive with him. And within a month, we reduced the amount of morphine that he was receiving from 16 milligrams to 8. We cut it in half. Now this child, who barely weighed 100 pounds, was able to leave his hospital bed in his bedroom and be in the living room with his family and be able to share dinner with his family at the dinner table, and leave his house and go to his brother's wedding and be the best man at his brother's wedding and dance with his sister at his brother's wedding. And the last few months of that child's life will forever be impacted in the minds of his mother, stepfather, father, siblings, nephews, nieces, of how he was able to have life and enjoy life to the fullest in those last few months.
Thank you very much, Dr. Joseph. I mean, it's good to know how even I think high THC or probably 1:1 product have been useful for pediatric risks, because even for practitioners it becomes a bit of a dilemma whether to kind of go aggressive. But again, understanding the condition and existing medication helps evaluate the entire protocol that needs to be set for the treatment, right? I think on those lines, Dr. Uma, I have a question, is that sometimes a lot of medications are co-prescribed, right? I mean, it's a very common practice to co-prescribe medication, and in those cases there's a lot of possibilities of drug-drug interaction happening, right? So how does one ensure that we do not kind of caught up in that, so that patients may end up with any type of cocktail inside their barely happening because of the medication. So your take on the how to avoid any possible drug-drug interactions and any medications that are very strongly reactive with cannabis, so that people can have a understanding of how to go about them.
Excellent question. So the question regarding drug-drug interaction comes with day-to-day life. People take one medicine, don't drink this with it, don't combine it, eat it on an empty stomach, eat it with food, take it at night, take it in the morning. So there's all of these things that are involved with taking a medicine. And I look at cannabis as a medicine. And so when we look at, again, delivery, we look at either inhalation or ingestion. When I look at inhalation, it goes through the lungs. And when we look at the lungs, from the lungs, it goes right into the bloodstream. This is why I prefer people to use inhalation as a first line versus going to ingestion, because you can titrate it. And I'm going to talk about that later when we talk about dosing, or I can even touch upon it now. So any drugs that have to be ingested means going through the liver can have a interaction. So the interaction, making it simple, is called a cytochrome P450 system. Any drug that possibly could interact, metabolized by the liver, can have an effect with cannabis when ingested. And this is why we are able to decrease their medications. We're able to lower, because we're able to understand that you can use cannabis as an adjunct. You don't have to use it solely. You can use it concomitantly with other medications. And that's how I follow my patients. First, you got to know what they're taking. You got to know what their baselines are. What's their kidney function? What's their liver functions? Especially if we're going to talk about liver issues and metabolized by the liver. And many drugs, we base it on weight, and sometimes even male or female, depending on their kidney functions and liver functions. So all of these factors do come into play, but it's very important to, if I had a blanket statement to say, I would say any drug that could be metabolized in the liver has a potential of interacting with cannabis. So alcohol is a big factor, and people will, drink and then blame the cannabis as their problem. Well, it's the alcohol, not the cannabis. Okay, so understanding these things are very, very important as well. The other thing what people can understand is that when you also use it through the rectum, okay, you're not going through the liver, you're passing it. So again, metabolisms, if you have concerns about the liver, look at other ways of getting it into your system so that it does not have to be impacting through the liver. And that also comes to the information as far as when people inhale. There's a lot of misinformation. We've talked about this word Dr. Joseph mentioned, that, inhalation of cannabis is the same as inhalation of tobacco. No, it is not. No, in fact, I can say cannabis treats asthma, treats reactive airway disease, treats COPD. We've lowered their meds, we've lowered their inhalers, we've lowered their steroids, we've improved their quality of life, we've improved their lung function. Because depending on inhalation, back in the days, we had asthma cigarettes. And guess what was in those asthma cigarettes? Was cannabis. And inhalation of cannabis was used for the treatment as bronchodilation, vasodilation, anti-inflammation, and guess what? Expectorant. That's why when people use cannabis through inhalation, they cough sometimes. And the coughing is because it's working. It's bringing things up. We have ALS patients that can't breathe. And this is the way they use the cannabis in a form of inhalation to be able to get the phlegm up so that they don't end up with pneumonia or other respiratory illnesses. So to answer your question as far as drug-drug interactions, you really need to look at what the patient is on, and even over-the-counter meds like Tylenol can impact their liver. So you need to look at all consumptions of things that they are taking into their body.
Understood. And to be, I think for asthma, you mentioned about smoke therapy is also very prominent in practice in Ayurveda actually for asthma actually. Yeah. Even cannabis is also prescribed the same. Dhoom yoga we call it here, or that's one of the I would say the Ayurvedic terms and Ayurvedic medications being made for it. Yeah.
In fact, I want to touch upon that because recently there was a research study that just came out about the impact of cannabinoids on COVID. We know that how I see those, I can purely say this, we did not lose, knock wood, not one patient in my practice to COVID. And I really believe the onboarding of cannabinoids in their system has been preventative. And, back in the days, they used cannabis for the treatment of tuberculosis. They made porridge out of this, and it was consumed because of the proteins for treatment. So there's so many things that we know in our own culture in India, and we've known in history that how this plant can be consumed in different ways. And what people have to understand with ingestion of cannabis, it does take longer for the onset, and it lasts for a longer duration. So onset is later, longer duration, because it has to go through the liver. And also people have to understand that the 9-delta gets converted to 11-hydroxy. And that is a conversion of a cannabinoid that lasts much more potent as well. And this is why some people will tell me that they ingest cannabis and they'll say, I don't get any impact from it. Some people, even the smallest amount can impact them. Size does not seem to be a factor. And it really depends on titrating the patient slowly. And that's the word I use with my patients is titrate, not dose.
No, yeah, absolutely. So I think on those lines, I would move ahead. And, Dr. Piyush, in your practice, and especially you're talking about the senior citizens, right? I mean, as the population ages, what do you see the role of medical cannabis comes into picture, in terms of helping, the senior folks of the country across the globe?
Right, Sumit. I think you touched upon a very important aspect, and I really liked the way Dr. Uma mentioned about that. Yes, all of us will be definitely going to die one day. But the point is, there are two aspects. Definitely dignity, or maybe we can say the level which we will be heading towards our end stage. However, on that, from prior to that, the main important aspect is the quality of life. One. Second, actually, the main aspect which we need to understand here is, see, why we are when we are aging. Aging means what? Aging means that in our body there are several systems, or at a cellular level, the health of cells, or maybe I will say the degeneration, or the cells are getting destroyed, or their efficiency is getting decreased. If you understand about at a cellular level, for each and every system, the cells, either they are getting destroyed, or they are getting their efficiency is getting decreased, or in that way there are so many aspects of them, there are so many health disorders. So in Ayurveda also we are having this entire domain which is known as rasayana, or means the regeneration as such, and we have so many already herbs which we have seen. So if we talk about cannabis also, we have seen in many research studies that first of all, the damage or the degeneration or the efficiencies of cells being decreased, in all those aspects cannabis is very helpful. And people who are taking cannabis in any form, and I really again I'm agreed with Dr. Uma that we can always take hemp seed and hemp seed oil, we can always take several other forms of hemp and cannabis which we can include in our diet, in our, and it's not about only diet, by the way. If you talk from the hair to the ankle to the bottom, every system or every organ of your body can be like getting benefited. Like today morning I was applying hemp hair oil. So there are like now hemp hair oil, there are hemp face wash, there are hemp shampoos, there are hemp cosmetics, there are in fact like we can eat hemp seeds and hemp seed oil, we can apply something on our skin. So in every way that person is aging, so their overall appearance, their overall like how they are like looking, that is very important. It is an excellent anti-wrinkle or a anti-aging remedy. Many cosmetic leading brands are now gradually launching hemp seed oil and hemp seed in their products. So from that note, to the extent of, we have already discussed about the degenerations, the degenerative disorders like Parkinson, Alzheimer. Prior to that, it's like we are not having a good memory, like the aging senior citizens. So the memory loss, or maybe the lack of recall, or maybe sometimes they are not that much focus. So those aspects also can be very well managed. Then there is very important aspect with the aging is the pain management. There are several kind of arthritis, there are several kind of pain, joint pain disorders, musculoskeletal disorders, and so many aspects are there, and they are already having so many medicines. And when they are taking painkillers or those kind of medicines along with their other medicines, so in that aspect also we have seen, starting from the local application, the external application of the certain oils which are from either the leaves or the hemp seeds, and then to the internal medicines. It is an excellent pain management solution, which we all know as far as the cannabis is concerned. So predominantly, if we see, then the gut health, the digestive system is being impaired, and in that aspect also, we have seen, be it colitis, be it overall digestion, be it overall increase in the absorption of the food, whatever they are taking. Cannabis can help and can improve in their digestive and gut health as well. Uh, and apart from that, like if we again talk about all the senses we have, in that aspect also cannabis is helping in certain aspects, to the extent of helping them in their cardiovascular health, in infecting, helping them to various other disorders, like as Dr. Uma again mentioned about the sexual health or the genital health and all. So in that aspect also cannabis is very good, certain kind of infection. So if you talk about the senior citizens, predominantly what we are getting in our clinic is, one, the first, if we talk the top three issues which senior citizens are having, first is the pain management. In fact, I forget to mention a very important aspect is the sleep, the insomnia or the short duration of the sleep. It can be a bit short as well during the age when it grows. Like if you are in your 70s or 80s, you can maybe sleep for lesser hours as compared to your younger age, but at least that quality should be there. If you are sleeping 5 hours, that is fine, 5 or 6 hours, but the quality of sleep should be good, so that you are able to make your entire day and manage your entire day in an effective way. So if you talk about the top three health issues which senior citizens are coming to our clinic, first the pain management. There are several like in fact musculoskeletal are still easy. The neuropathic pain is a bit difficult and challenging to manage with the standard of care, and where cannabis is an excellent remedy as far as the neuropathic pains are concerned. Fibromyalgia of the world and all also being managed by cannabis. So pain management predominantly. Second is the, again, the mental health, you can say, or the sleep quality, or certain kind of degenerations. And third, the digestive system overall. These three aspects are predominantly there in the senior citizens. Their overall quality of life is there. And yes, the final aspect is their happiness, the way, because sometimes they are lonely, their children are grown, they are living alone, maybe they have their partner, they don't have their partner, and that psychological state of being lonely or maybe managing with some challenges and all, generally they are not sometimes happy and all, but cannabis makes them happy, their happiness index increases, their overall psychological health improves. So in all those aspects, I think it is an excellent solution which should be given to all the senior citizens, either in the form of medicine or in the form of food, or at least as a rasayana, which we say in Ayurveda. So in any aspect, if they can take and they can adopt, and the still there is some negativity around that, which if we are able to convey and create the positivity around this herb, this plant, I think that will definitely help to all our senior citizens to live their life with a better quality, and to like manage their daily. See, my only concern is at any age you are, at least you are able to manage the entire stuff on your own. That is the main thing which we are looking for as a clinician, and our goal is to make them self-sufficient, to at least manage their basic day-to-day life on their own. They should not be dependent on anyone, which I feel cannabis has the ability to make them at that level. Right.
Thank you, Dr. Piyush. I think we've been talking about a lot on the use cases and the condition where cannabis is prescribed. But however, there has to be certain conditions where cannabis can be, counter-indicative, where cannabis should not be prescribed if they may exist. So my question to you, Dr. Joseph, is that what are the certain conditions where medical cannabis should not be prescribed, or if prescribed, has to be done with extreme caution?
Well, truthfully, there's no condition that, or no situation where someone should not be able to receive some form of phytocannabinoid. And I'll explain why, especially from the whole plant or full spectrum. As Dr. Uma mentioned earlier when she spoke about the endocannabinoid system and spoke about the presynaptic neuron and the postsynaptic neuron and the synaptic cleft and the formation of the endocannabinoids at the postsynaptic neuron moving retrograde to the presynaptic neuron and working on those receptors. Something that is found in that movement from the postsynaptic to the presynaptic are two enzymes, MAGL and FAAH. Fatty acid amide hydrolase and MAGL. Both of those attack our endocannabinoids. FAAH attacks anandamide, and MAGL attacks 2AG. Now what happens? CBD blocks the action of FA, and THCV blocks the action of MAGL. By blocking both of those, now you are allowing the endocannabinoid system to express itself. So for that reason, everyone, I mean everyone, should be on some form of cannabis-based plant medicine, whether it's coming from hemp, coming from an extracted oil from hemp, coming from the medical cannabis plant. Now, as far as conditions go, a lot of talk and a lot of things have been mentioned regarding mental illness, specifically schizophrenia. There are very small amount of studies that are done that have been skewed, or on the way in which they were conducted, the information is not as accurate. And so there may be some misnomers or misinformation. But the key and our mantra in the cannabis world is start low, go slow. And as Dr. Uma mentioned, we want to titrate up to effect. We don't automatically say, okay, one size fits all. For example, if someone comes in with some type of sinus infection and they get a medication called Augmentin, which is amoxicillin and clavulanic acid combined, the dose for an adult is 875 milligrams of amoxicillin, 125 milligrams of clavulanic acid combined, and that's it. And you take it twice a day for 10 days. Doesn't take into consideration what other medications they're taking, doesn't take into consideration how much they weigh, doesn't take into consideration what their liver function is, what their kidney function is, what their, how, if they are a fast metabolizer, if they're a slow metabolizer. That's what it is. With cannabis, as Dr. Uma so intelligently stated, it's personalized medicine. And we have to start low, go slow, titrate up to effect, and work very closely with a healthcare professional that is experienced in this and isn't treating people willy-nilly and saying, oh, just take whatever you need and go with it.
I mean, yeah, that's obviously the key towards success. Even as I have also seen, there's a lot of a bit of a counseling involved, a bit of understanding how things are with the patient. So I think since on those lines, I would like to ask Dr. Uma, is that when you are, when the titration is probably the best way to understand what, cannabinoid suits you, what amount of cannabinoid suits someone, or in what forms, what are the key communication that needs to be made to a patient so that there are no, bad experiences, right? I mean, it is likely someone may ingest higher than that they're supposed to be, or maybe they're first timer a medical cannabis consumer, and there can be a lot of things can happen, bad experience that we need to omit out, right? Because of the stigma, people may just avoid cannabis, because I know there are so many people that we have to sit and counsel and tell them how not bad it is, right? So how do we avoid those situations? What kind of communications to be made to a patient so that there are no bad experiences?
Well,
I love this question because
oh, go ahead.
So this is kind of what the Dr. Uma says rule book, okay? And I tried to make this very different because allopathic medicine is very dose. And Dr. Joseph mentioned, 850 milligrams of this, 250, 500, whatever the daggone dose is, it's going to be a pill that's synthesized every time, okay? So somebody could say, I dose my blood pressure medicines, I dose my whatever. When it comes to cannabis, I'm very, very clear. It's titrate. I'm a chemical engineer's daughter, so everything has a process. I'm the daughter of a statistician, so everything has to add up. So my thing is process, and it has to add up. Otherwise, it does not compute to me, okay? So this is some of the philosophies of how the 3 rules are. Rule number 1, you must hydrate before you medicate, is Dr. Uma's rule number 1. Why? Because people just don't hydrate enough to begin with. And if they're dehydrated to begin with and they're already anxious, you're setting them up for failure. So you must hydrate before you medicate. And I usually say, don't drink plain water, add a little lemon, lime, or ACV to it. So that's rule number 1. Rule number 2, Dr. Uma's rule is you must have food on board before you medicate. Because a lot of people will say, well, I got the munchies. Well, no, you were hungry to begin with. And if you don't eat, your blood sugar is going to drop. And that's going to create anxiety. And that's why the second thing is you must have food on board. And the third rule of Dr. Uma's is you must write it down. I'm still old school. Sorry. I still have notebooks and I tell people journal. Now we live in the world. Exactly. So the 3 words of Dr. Uma's besides titrate is hydrate, food, and journal. 3 words that must be part of the rules when you tell patients, because safety first, do no harm is what Dr. Uma says. And I repeat this because low and slow for somebody is different than for everybody else. Somebody will eat the whole candy bar and then they'll say it's too much. So I've seen that happen. You may feel like you're dying if you take too much, folks, but you're not going to die. That I can tell you, okay? That I can tell you. And the reason we want to talk about that is the brainstem that controls our heart rate and our breathing and our temperature cannot be blocked with cannabis. And that's a very important fact, that cannabis is non-addictive and you cannot overdose from it. So very important factors. The other thing that we want people to understand is that it is a neuroprotectant. So if we can understand people that you can take a small amount, microdosing is people what are doing. Seniors, I really believe we're having a much larger increase in older people above the age of 65, and we're going to see a decrease in people under 18. And Dr. Piyush already mentioned chronic diseases are going to increase. Chronic pain, hypertension, diabetes, arthritis, renal failure, mental health issues, neurological diseases. So if we can understand these 3 rules and understand the concept of titrate and slowly going up and down. And what I'm going to tell you, the other thing is, Dr. Uma calls it a U curve when it comes to cannabis. There's people that are depleted and there's people that are over medicated. So you're going to find that as you start to use cannabis, you can actually start using less if you use it appropriately. And it goes along with 2 words that I want to establish in everybody's mind: conscious use. I don't care what you're doing in your life, please, conscious use. Understand whatever you put in this lovely body, that you got only one body and one life. And that's why the endocannabinoid system is involved with every part of your life, from the beginning of conception to helping you die.
That is very, very beautifully answered. Dr. Joseph, you wanted to add something, please continue.
It's important also to understand certain sweet spots or different areas where they work, especially with inhalation, different temperatures, because you have different phytocannabinoids in the plant, and each phytocannabinoid has a different vaporization point. So if you're at a lower temperature, the decarboxylation or the loss of COOH that makes the acid form, so CBGA converts to CBG, CBDA converts to CBD, THCA converts to THC, the acid form to the active form, but each one has a different vaporization point. And so it's important to understand what it is that we're managing or addressing, and which one of those phytocannabinoids is going to work the best, and at what temperature you want to be able to take advantage of the plant. That way the plant you're able to use it more times for different things. So that's why people say, you're selling snake oil. Is it good for everything? Well, yeah, it's pretty much good for everything, because at different temperatures, you have a different medication that's going to work on a different receptor addressing a different condition.
Now that's interesting and makes the job of manufacturers difficult to kind of enable those deliverables. But yes, I mean, that's very, very critical. Another thing that is critical for, I believe this is purely a question from a medical practitioner's point of view, is that if you are a medical cannabis practitioner, right? This question is to Dr. Piyush, is that to the Indian demography, right? I mean, what are the key aspects that you should ensure or maintain, right? I mean, because when we were, registering, a lot of doctors kind of asked the same question: is that as a practitioner, can we prescribe medical cannabis? What are the various factors to consider while we do so? So, Dr. Piyush, if anyone is willing to, start prescribing medical cannabis, what are the key suggestions that you will offer them?
Yeah, I think a very good question, Sumit. And I again want to emphasize on one aspect. See, what we need to understand, I can talk and I can speak in the context of Indian practitioners right now, because I am located in India, and we have a platform and network, and all the audience predominantly right now who are watching this session live are practitioners and doctors from India. There are few from international locations as well, as I can see. But for them, Dr. Uma and Dr. Joseph will be the better person to answer to this question. My answer will be specifically for the Indian practitioners. So there are 3-4 aspects which we need to understand as a practitioner. First and foremost, although the research studies, the overall footprints in the current context are more in West, but there are some ancient knowledge and ancient wisdom which we have as far as Ayurveda is concerned. Now the problem starts that sometimes I have seen, for knowledge it's fine. For knowledge you can read all the research studies, you can refer all the research studies, but for practicing there are some ground level challenges. Like the scenario right now is, I have seen some doctors who have started recently. On one side they are reading or they are doing some kind of orientation and trainings from the Western training organizations, or with some doctors and all. But the problem is the medicines which are being prescribed or recommended, as Dr. Uma mentioned, are very different from the medicines which we are using in India right now. That is point number one. So when you are having an understanding of the fundamentals of the concepts based on the medicines which are there in US, Canada, Italy, Israel, Europe, whatever countries we are seeing are leading as far as the cannabis research is concerned, the way India right now is manufacturing, cultivating, to start from the cultivation to the manufacturing to the final end product or medicine which we are having is very different. So that we need to understand first of all, and accordingly we need to have some internal understanding or internal know how to practice the medical cannabis here in India. If you are getting some important medicines from US or Canada or those countries, and then definitely you can correlate. But for Indian scenarios, the Indian companies, the medicines are a bit different. That is point number one. Second, see, there are some local challenges as well. As correctly mentioned by Dr. Uma, in US, state specific regulations are there. In India also, although overall all the Ayurveda doctors and other like pathy doctors also, for other pathies there are some discussions and some controversial aspects are also there, but because right now in India only Ayurveda licensing authority has approved these medicines, so technically an Ayurveda doctor can prescribe. Here we can prescribe as a medicine, we have that authority and power because it is being labeled as Ayurveda, either classical medicine or proprietary medicine in our country. So that confusions are still there among the practitioners, that whether we can legally prescribe this, whether we are coming under the purview of narcotics or not, whether like we can get some audit or maybe face some heat if we are prescribing medical cannabis. Still I get so many questions, especially from the southern part of India. Their doctors are still in a mode of some resistance. In north, because this plant is being prevalent, is being used in our some cultures, some festivals like Holi, people used to drink bhang and all. So they connect and they are still more comfortable as compared to the southern part of India. So in that context, I would like to clarify on this platform, and we have done in many other platforms as well and many other sessions, that it is pretty legal. Please start practicing. But on the same note, have some basic knowledge first and then start. It's although it's a plant-based medicine, it does not have any issues or side effects as mentioned by our speakers. It is one of the safest drug or like herb, I can say. Till now, not a single death certificate in the entire world is have the reason that the cause of death is cannabis, to be very frank and to be very honest. If I am wrong, please correct me, Dr. Joseph and Dr. Uma. As per my knowledge, there is no single death certificate in the entire world which they are there like there's a reason of death is cannabis. As per my knowledge, I have not seen any death certificate till now. So this is so much safe, right? Now, on that note, please do not directly get involved in the practice and start prescribing or dosing abruptly, because it's a bit sensitive. Your patients can have issues if you do incorrect dosing. That is also very, very important, which I have seen in some Indian practitioners. So please first understand, please connect to your peers, connect to your seniors, connect to doctors like Dr. Uma, Dr. Joseph. I have some knowledge, not that much which they both have, but at least connect with some good doctors who are practicing and understand. First, dosing is very important. Timing of the dosing is very important. How you are increasing, how you are decreasing. There has to be some gap in between as well. It's not that you start prescribing the cannabis and for maybe weeks or months or years they are taking medicine in the either on the same dose, or you are increasing or decreasing. There has to be some gap also in between, right? So the like in layman language I will say, you have to reset the body as well after some time when you are giving the cannabis. So that you have to press the reset button, you have to pause for maybe some days or some weeks depending on your patient. That is very crucial, which many practitioners are missing in the practice of medical cannabis. So and third and very important aspect is in Indian context, many doctors are getting confused from the Ayurveda perspective. They are understanding this, sir, and then when they are studying the scientific aspects, the modern research, the endocannabinoid system, so sometimes they are trying to connect. We can connect. We know about Vat, Pitta, Kapha in Ayurveda, and Vat or Pitta are having some traits as compared to ECS or endocannabinoid system. But please do not get confused. It's very simple, by the way. If you have Ayurvedic classical medicines, practice as per Ayurveda. If you have a proprietary patent or medicines like tinctures or these kind of medicines, please practice as per the scientific or the modern parameters. So please connect those with the respective theories or the respective sciences, I will say. Again, I repeat, if you are practicing classical medicine, connect with your Ayurveda hypothesis, like you are practicing Trilokya, Vijayavati, Kameshwar, Modak, whatever. Please refer to Ayurveda and practice accordingly. If you are practicing tinctures, extracts, vapes, or whatever form, please connect to the scientific community of the entire world, the modern research, and accordingly practice. So please have that bifurcation in your practice. Do not confuse and do not mix both of them in terms of the scientific aspects are concerned. So that I need to convey right now. We have done exhaustive sessions on trainings and many other points we have covered, but at least right now I want to just convey these aspects, and maybe Dr. Uma and Dr. Joseph can add some points for the international practitioners and maybe some tips for Indian practitioners and doctors also, in addition to whatever we have just discussed right now. Thank you.
We're suffering with the same issues here in the United States and globally. Doctors don't have the incentive, I'm sorry to say, to practice cannabinoid medicine. In fact, they're given misinformation. When I first started writing recommendations in 2012, I had no net. I didn't have the government to protect me. I didn't have the medical community to protect me. I had really nobody other than my patients. And today, I'm very proud of what I do. I'm not part of the problem. I'm part of the solution. So I would really love our colleagues to understand that this is a plant. It should not be treated like the way we treat pharmaceutical drugs. It's very different. And you have a person, and use our, especially in India, folks, we come from Ayurveda. Ayu means life. Veda means knowledge. And this beautiful plant is a sacred plant. And so you have to understand that we as clinicians, I'm sorry to say, we were given algorithms, standard operating procedures, research data, 100 people we studied, we did statistical analysis, and we published data. No, look at the person, listen to the person, please, and understand that you're willing to write a prescription for a drug that has a potential to kill them. And this plant, as we've said repeatedly, has killed nobody. Nobody in the world has ever died, but you must have safety first and do no harm. There are precautions you must take, regardless of what you do. And I want to say, the endocannabinoid system in one word is life. And we have an opportunity to use this plant and other plants we're going to learn about, other phytocannabinoids, other things that work with the endocannabinoid system. But the endocannabinoid system is involved with every system, every dis-ease, to come back to where we started this meeting this morning. And it is part of life and every aspect, and especially the seniors. I'm a senior and I support my seniors. We must have a quality of life, and we've impressed here activities of daily living, being able to be independent and prolong a quality of life, not just prolong an illness life. And that's what this is about. And I'm very happy to be here today and share this knowledge with everybody. And you can contact me at upliftinghealthandwellness@gmail.com. I do consults for people all over the world, so please don't hesitate to contact me. Thank you.
And to dovetail on both my doctor colleagues, if any of you have any questions regarding how I practice, how I manage children, how I take care of all of the debilitating qualifying conditions, but primarily in the arena of pediatrics, you may reach me at info@josephrosadomd.com, info@josephrosadomd.com, and my website, josephrosadomd.com, josephrosadomd.com. I've already received some invitations to connect via LinkedIn. On LinkedIn, I am Joseph Rosado, MD, MBA, Joseph Rosado, MD, MBA. So any questions regarding questions pertaining to children, questions pertaining to chronic debilitating conditions, please reach out to me. You can also purchase my book through Amazon, Hope in Healing: The Case for Cannabis. It has a lot of the information that we discussed here today. It's available there. The first half of the book is specific to what we discussed today. The second half of the book is specific to qualifying conditions and debilitating conditions. So there's a chapter on epilepsy, there's a chapter on Parkinson's, there's a chapter on ALS, there's a chapter on cancer, there's a chapter on HIV and AIDS, etc.
Just one, I think one question I have, and probably that will be the concluding remark from all three of you, is that how do we go about the tapering off when it comes to the cannabis medicines? How do we strategize the tapering off from the medication, right? You get someone on the medication, they are there for a period, and then obviously they need to exit the drug as well, right? Nobody will continue to live on a medication for their entire life. So any thoughts on that, and then obviously we'll head towards the conclusion.
Well, as Dr. Uma stated previously, the goal is titration. So doing titration is the key. So we start at a low dose and then build up and document how much medication you're taking every dose. I usually start for the first month. I don't make any changes on their conventional medicines. I introduce the medical cannabis at the lowest dose possible. And we do every week, we increase the dose of the medication or the titration of the medical cannabis. And then after 1 month, I follow up. They've been keeping a log. So if it's, an example, an epileptic patient, I have the mother keep, or the parents keep track of the number of seizures they've had, how long the seizure was for. That way we can monitor the number of seizures that they have per day, and we can see how it begins to decrease. And then once that happens, we pick one medicine to wean off of at a time, because we don't want to do too much to the body, because we don't want to insult or affect the body in any way. So we start at a low dose, leave everything the same after 1 month, and then after 1 month, we pick one medication and we start working that one low and increase the other, and then until eventually we get them off of everything. And it's not overnight. I've got some patients that I've been working with for 5 years that we've been working slowly to get them off of everything. So this isn't one size fits all, and it doesn't happen overnight. You didn't start taking these medicines yesterday. They're in your system, and so it takes a minute for us to get through all of that.
Amazing. I think we kind of ran 30 minutes out from our scheduled time, right? And there's so many people with so many questions, and obviously talking about medical cannabis cannot be limited to a time frame, And I'm so glad that you all three gave time to this discussions, to this wonderful knowledge sharing. And so many people are even now texting me a lot of questions that and there's so many questions out there. But again, people can write the panelist, and obviously hope to connect them in other methods to kind of have any clarity done. And I guess this is where we end. And if you guys, if you want to add something from your end as a concluding remark, we'll close with those remarks. Please.
So what I suggest here is, Sumit, we have shared, I think Joseph has shared the email ID. Maybe we are connected to all of you. We have shared the email ID in the Zoom chat box, and those who are watching on YouTube, what we will do is we will share the email ID. So whatever the questions and whatever the queries people have, just a second. Whatever the queries and whatever the questions you people have, please email us, and we will try to connect with Dr. Uma and Dr. Joseph accordingly. And we will request them. This was just first introductory session. We will request them, and we will definitely discuss with you how we can take it forward and develop some more sessions, or maybe some kind of structured say trainings or those kind of aspects as well. We will have a discussion maybe on one-to-one basis with you, Dr. Uma and Dr. Joseph, and accordingly we can take it forward, because training a structured way and in whatever the system which we can evolve, is very much required, and I really like the experience, the knowledge, and overall, like it reflects in the body language, in the way Dr. Uma and Dr. Joseph are communicating and expressing their points. So we definitely need more and more people like you for the guidance, for the hand holding of the fellow practitioners, and that is the aim of this entire exercise. So it was just a trailer of the entire movie today. So, or maybe the web series in this OTT world, I would say. So this is, in fact, it's not a trailer, by the way, it's a teaser right now, because the amount of knowledge you people have is so huge that I will say this is a 1.5 hour teaser today, which we have done. Trailer will follow, and movie and the web series will follow accordingly. Thank you.
Thank you. Thank you so much, everyone.
Thank you, everybody. We look forward to helping in any way we can. One life, one body.
Sure.
Thank you so much, Dr. Ma.
Thanks, Dr. Uma. Thanks, Dr. Joseph.
Bye-bye.
Thanks
Thank you
Sumit
so
for
much.
ensuring
Thank you,
this
sir.
session. Thank you. Thanks.